Your stroke center is achieving good results. Do you want to leverage that within your location area to help other hospitals to improve while you reach greater results? Here is how a partnership with Medtronic could help you. Imagine that each year, your comprehensive stroke center is admitting 900 patients, and your reperfusion treatment rates are improving on average by 10%. However, to attain optimal targets, you may want to take some actions. You also know that your colleagues in the next town are struggling in identifying, treating, and referring stroke patients. You foresee that establishing a telestroke between the hospitals will contribute to help your colleagues to improve their patient pathway, establish the provision of thrombolytic treatments, and at the same time help you treat more patients eligible for endovascular treatments, as they will be referred more efficiently from a hospital within your network. To implement that, you will need to get the backing and support of the decision makers to be able to move forward with your plan. Through partnerships, Medtronic can support you to develop your business case to facilitate the budget allocation for your Telestroke program. We will use the Stroke Care Economix tool that provides a framework in which you will be able to assess the patient's benefit and the cost implications of the telestroke. To implement a telestroke service, imagine you have identified that the main requirements are materials and equipment, training sessions, diagnostic tools, and resources required to transfer a patient. All those elements can be included in the Stroke Care Economix model to determine the patient benefits and the economic impact of implementing the telestroke. A strong collaborative process between you, a proximate hospital, and Medtronic will be required. We will collaborate in the data collection process, the determination of all the required resources for your telestroke program, and simulations of the potential scenarios. So, you will be able to estimate, for example, the impact of implementing the telestroke on number of patients diagnosed and referred on time. For example, 60% of large vessel occlusion patients referred by primary stroke centers to the Comprehensive Stroke Center. The potential number of patients treated, reaching, for example, 18% acute ischemic stroke patients treated with IV-tPA and 10% treated with mechanical thrombectomy in 5 years, and the increase of the proportion of patients achieving functional independency, as well as the resulting costs respectively for both hospitals and the healthcare system in the short, mid, and long term. With the results of our collaborative work from the previous phase, we will be able to build your business case together and provide you with the tools to communicate with impact to the key healthcare decision makers to facilitate your journey to obtain the funding and resources that you need to implement the telestroke, which ultimately will benefit the patients. Let's partner together to inform healthcare decision makers about the value of optimizing stroke care and the meaningful benefits that can bring to your patients. Let's partner together to communicate with impact. Medtronic is your stroke care partner.